Metaplasia, it is a reversible change in which one differentiated or mature cell type is converted to another type. Metaplasia, epithelium gets converted to another type of epithelium. Epithelium gets converted to another type of epithelium. Mesenchymal metaplasia, mesenchyme gets converted to another type of mesenchyme. दो टाइप का मेटाप्लेशिया होता है, एपिथेलियल मेटाप्लेशिया, mesenchymal metaplasia. It is a reversible change in which one differentiated cell type changes to another type. Epithelial metaplasia and mesenchymal metaplasia. Mechanism: reprogramming of the stem cells. Reprogramming of the stem cells. Examples: most common metaplasia. In smokers, the pseudostratified ciliated columnar epithelium of the respiratory tract. In smokers, the pseudostratified ciliated columnar epithelium. The pseudostratified ciliated columnar epithelium of the respiratory tract converts into stratified squamous epithelium. This is known as squamous metaplasia. Squamous metaplasia is reversible after the cessation of smoking. Most common example: in smokers, the pseudostratified ciliated columnar epithelium gets converted into stratified squamous epithelium. This is an example of squamous metaplasia. Squamous metaplasia is reversible after the cessation of smoking. Barrett's esophagus, it is an example of columnar metaplasia. Barrett's esophagus or columnar lined esophagus, or CLO, stands for columnar lined esophagus. CLO stands for columnar lined esophagus. The stratified squamous epithelium of the esophagus is converted to columnar epithelium. Esophagus में stratified squamous epithelium होता है which gets converted to columnar epithelium on exposure to GERD. On HPE of Barrett's esophagus, intestinal metaplasia and goblet cells are seen. Intestinal metaplasia and goblet cells are seen. Histopathology of Barrett's esophagus, intestinal metaplasia and goblet cells. Special stain for Barrett's esophagus is Alcian blue. Alcian blue is the special stain for Barrett's esophagus. Goblet cells produce mucin which stains the Alcian blue. ठीक है, हिस्टोपैथोलॉजी में एक इंटेस्टाइनल मेटाप्लेशिया मिलता है और गोबलेट सेल्स मिलता है. स्पेशल स्टेन इज द Alcian stain. The goblet cells produce mucin. Goblet cells produce mucin which stains the Alcian blue. Which stains with the Alcian blue. Barrett's esophagus is a risk factor for esophageal adenocarcinoma. Barrett's esophagus is a risk for esophageal adenocarcinoma. So Barrett's esophagus is also known as CLO, that is columnar lined esophagus. It is because of GERD. Okay. On exposure to GERD, the stratified squamous epithelium of the esophagus is converted to columnar epithelium. Okay. Histopathology of Barrett's esophagus में intestinal metaplasia, goblet cells are seen. Special stain is Alcian blue. The goblet cells produce mucin which stains with the Alcian blue. Barrett's esophagus is a risk factor for esophagus adenocarcinoma. Barrett's esophagus is a risk factor for esophagus adenocarcinoma. Special stain is Alcian blue. See, esophagus में generally normally stratified squamous epithelium रहता है, but on exposure to GERD metaplasia होता है तो intestinal epithelium is seen. Barrett's esophagus में intestinal epithelium और goblet cells are seen. See, Alcian blue positivity for goblet cells. The goblet cells secrete mucin which stain with the Alcian blue. Vitamin A deficiency can also lead to metaplasia. Example of connective tissue metaplasia is myositis ossificans. Myositis ossificans is an example of connective tissue metaplasia. ठीक है, इसमें bone is formed in the muscle due to intramuscular hemorrhage. On intramuscular hemorrhage, bone will be formed in the muscle. This is known as myositis ossificans, which is an example of connective tissue metaplasia.